Hello, I'm Mary Jo Batty. I have been a massage therapist in the field of holistic therapy for the last 30 years. Graduated from a very prestigious school, the Boulder School of Massage Therapy, back in 1983. The importance of hydrotherapy or hot and cold therapy. Let's make a note of the hot and cold therapy. I'm going to just allude to hydrotherapy for a moment, because I think that these can have a really wonderful therapeutic benefit in the area of healing injured tissue. If you tend to have a injury, let's say you stubbed your foot, or you maybe dropped a heavy brick, I hate to say it, but maybe a brick on your foot. Okay, that happened to me. A 250-pound concrete table slab top fell on my foot years and years and years ago out of a wheelbarrow, and that was a lot of weight and it hurt, and I thought I broke my foot. But what happened is I used the hydrotherapy to heal this, and it was amazing. In 24 hours I was walking on my foot. And I will tell you that if you utilize the effects of cool to reduce the inflammation, to help release, you know, just when you make a vasoconstriction is what causes the body to close down the blood vessels and prevent too much blood from coming in. Okay, so when you hurt yourself initially, there is kind of a response. There's a circulatory response. It wants to bring all that blood flow to the area, and there's a kind of an endothelial response that brings all that kind of a nitrous oxide release into the circulation, brings all that energy right to the area, and it kind of braces it and swells it up a little bit, and it's all the, you know, like the red blood cells are coming to the aid of the white blood cells and trying to, you know, kill off anything that's inflammatory, and then, you know, digest it and take it away. And sometimes we want to kind of slow that process down, that swelling, to kind of create a way of allowing it to kind of heal in a more an easier manner. So I might use my cold therapy to reduce by vasoconstriction, which it means tightening the blood vessels, to kind of push out some of that blood flow and kind of control that inflammatory response. And so what I did is I ran some lukewarm to cool water on the area for about 20 minutes. It takes about 20 minutes to help to move that inflammation out, create an anesthetic effect with the dipotement, which is a light percussion from the water. But I'm also thinking that as I'm looking at these products, how beneficial it could be. You don't always have a water spigot near you. You can't always put your foot in a running stream of water. Sometimes you're in a hurry to get off to work, and you can't just, oh, I'm just going to take a little 20-minute side, you know, trip to my bathroom and sit on the edge of my tub and try to reduce this inflammation before I go to work. Sometimes you just have to get where you need to go, and you don't have that time availability. So I am looking at using these products. You take a cool, an icy one out of the freezer, and just lay it right on the area. Maybe I laid it on my foot, you know. But the other important part of that, you know, reducing that inflammatory response is the dipolement. It's kind of like that light massage. And like I said, I'm a massage therapist, so I use a lot of dipolement in my work. With elderly, I use a lot of butterfly dipolement to help move the circulation back to the heart. And so what you're doing here is when you put the cold pack on the area of inflamed injury, and you add a little bit of dipotement through the bag. And I would just pick one that just fit just perfect and it's nice and cold, and you got that flaxseed, and you know you're not hitting directly on it this way. That's why water is so nice. At first it can be very intense, but it's kind of a gentle stream. You don't have to use a really hard force. So if you're going to use your fingertips on the area, it's nicer to do it through the pad, because that flax is soft and smooth and it's receptive, and it's less confrontational to the body to just do that dipolement right through the bag itself. And you can just be working that, and you know, so you're on the way to work. Let's say you're driving down the road and you can drive with one hand. You can, if you injured something around your knee or something, you could, you know, maybe be lightly dipoting it on the way to work, and you can, by the time you get to work, you know, you've probably got your 20 minutes in. So it's one way that you can help to hasten an injured tissue. The other thing would be is the alternating hot and cold. Hot and cold alternating is very powerful adjunct in our therapy, because when you have an injury for the first time, like what I did, I want about at least 24 hours of cold ice, some kind of ice massage, very cold treatment that helps to reduce that inflammation so the body can heal. And then after about 24 to 48 hours of cold or ice, I would then move towards hot and cold. And hot and cold would be a balance of like let's say running your hand underwater for 5 minutes of hot to like 2.5 minutes of cold. It's like half the amount of cold to the amount of heat. And so in this situation, we would have water. We would use our rice bags because they're easy and less messy with the water and everything. And you can take one and you could put it in the microwave for like no more than about 3 minutes, depending upon the size of the bag and all. Might be less if it's a little eye pillow, right? But you would put it in the microwave and get it nice and hot. And then you'd have the one that you just already have like been in the freezer for maybe about 24 hours, or more. Hopefully you have them just set in there for emergency situations. But at least you've had one in there for at least minimum about 24 hours to get that really nice icy kind of feel to it. And then what you would do, and have a few of those, the heat can maintain for a little bit longer than sometimes the cold. The cold might, just kind of, your body heat is going to start getting warm. So if you have a few of them, it's perfect. And then you would have like 2 or 3 of them sitting out, and maybe a couple hot ones, I don't know. You just start with, again, you injured yourself, so just start with cold, because that kind of helps to reduce some of that inflammation that's been just, that circulation that's been just rushing to the area. And you just put it on there. This is my cold one. And I would do probably about 2.5 minutes to start out with, because the most important thing is alternating and having time to go back and forth. Because what you're doing is you're creating that vasoconstriction for 2.5 minutes. And then you're putting the hot one on, and that's going to create vasodilation for about 5 minutes. So you just pushed out some old blood flow, some old metabolic waste, just whatever is caused some of that inflammation to happen. And now you put the heat on, so you're opening the blood flow to come into the foot and bring fresh blood. Okay, fresh blood is really important, but it's also going to pick up some more just garbage, and you're going to want to put, after 5 minutes, another icy one on there, okay? And maybe you might want to have it like in the freezer, so you might have to sit closer where there's some like access to the cold ice pack. Otherwise, you can even, it just depends upon how long this cold will stay cold as you're doing this process. So, but you can just then throw the cold one on. Then what you got is vasoconstriction again. So all that blood flow that's come in from the hot pack, and put another cold one on, and it's going to just push out that blood flow, okay? Which makes room for the next time you put a hot one on, let's say, opens up, vasodilates, and brings more fresh, clean blood flow to the area. You're kind of cleaning out the area. You're bringing healing. Circulation is the healing is really in the circulation a lot of times in the blood as it comes to the area and brings the nutrients that the body needs to heal. So, and then I would end with, if it was just a real fresh injury, I would end with a cold therapy, because then that again reduces that vasodilation and all of that. But if it's like in the time frame where you're going to be doing hot and cold therapy, and you can, and the area isn't so inflamed, then you can end with whatever feels comfortable. Maybe you prefer ending with hot, then you may end with hot. But otherwise, if you're still in some of that inflammatory condition, it's always best to end that treatment with cold. So this is just one of the, maybe a couple of wonderful aspects of using the bags that are available right here. These, I've been using them for years, actually. I love using them. I love to do a massage on somebody and then finish a body part and then lay like on the back, I'll be doing a nice effleurage, a nice deboulement and some petrissage, and just maybe treat an area, and then at the very end, as I cover them with a sheet, I put a nice, long rice pack on the spine, and it just helps just soothe. And I can put my aromatherapy oils on, before I even lay this down, and then that helps to pull the oils deep into the body. With this, you don't really need to have the oil. You can have the herb, and you have that release of the herb in the flax seed that will do its work, without having to apply the oil. Anyway, I enjoy as much as I've enjoyed them, and I hope to find yourself a place, a really comfortable, cozy place where you can just kind of light a candle and get the ambiance going, some nice soft music, and just have a date with yourself using these wonderful hot cold packs.